myself, Dr. Darshan Rana. Thank you for your kind introduction. Uh, First of all, on behalf of BD, I would like to thank Manipal TRUtest for considering BD to support this event. So my topic for today's present. So my topic for today's presentation is optimization of blood culture practices using BD Bactec blood culture solution. As we know, infection due to any cause, if not timely diagnosed and treated promptly, it might lead to undesirable outcome and it might lead to mortality. So for timely diagnosis, it is essential to do the blood cultures, and no other test is important for diagnosis of infection. For diagnosis of infection, that may lead to sepsis. That may lead to the sepsis for the clinician. So the blood culture, as I said, is a key investigation for diagnosis of sepsis and is considered gold standard. It is used to detect the presence of bacteria, that is bacteremia and fungemia in the blood. Since the density of bacteria in the blood is very low, it is important that it should be increased to the detectable level, and it can be done only by blood culture. And also advantage is that it also dilutes any antibacterial substance which might be present in the blood. So positive blood culture helps the physicians to identify the infectious etiology of the sepsis, as well as provides the etiological agent. This etiological agent for doing antimicrobial susceptibility testing, as well as to optimize the antibiotic therapy. So physicians can find the source of the infection and start the targeted antibiotic therapy. So as I said, the clinical indications, mostly the clinical indication is suspected sepsis, in which the blood culture is indicated. Then other indications are endocarditis. Endocarditis in which there is continuous bacteremia. So according to major criteria, Duke's criteria, blood culture is an essential investigation. And also like typhoid fever, the culture becomes important. So I don't want to take you much deep into this. So, but many times the cultures are bypassed. There are various reasons for this. Some people feel they are costly and it's not needed. Reports come late. They have started on empirical antibiotic therapy. Services are not available, and also blood cultures are often negative. There are various reasons for it, which I'll be covering in the subsequent slides. And other challenges like culture bottles are not available, etc. So there is a need to optimize the blood culture. There are challenges that we face during blood collection, and if the blood is not collected properly, it might lead to lower recovery, which might lead to false negative test. And also the contamination, which is the important hurdle faced by the microbiologist, it may lead to false positive test, and prompt treatment may not be delivered to the patient. So we need to optimize blood culture. Therefore, skilled techniques are needed to adopt to overcome these challenges. So how can we do this? How can we optimize blood culture? There are various guidelines which are available from Clinical and Laboratory Standard Institute, Center for Disease Control, WHO have provided various guidelines. So I will take you through these guidelines. So one of the important essentials of blood culture procedure is volume of the blood to be drawn. This is the most significant variable in recovering the microorganisms from the patients. Okay. So more the volume of the blood, the more the positive is the blood culture. So it's directly proportional. So 1 second. Yeah. So here we can see in this picture, as soon as the volume of the blood is increased. So ideally, when we do the blood collection, it is recommended that in each bottle there should be 8 to 10 ml of blood. So as the volume of the blood increases, you can see the percentage yield is also increases. So like 60 ml of the blood will increase the yield to up to 100%, like more than 90%. Also here we can see, so the volume volume of the blood is increased. So like if 5 ml of blood is only collected, the relative yield will be only 10%. But as the volume of is increased up to 40 ml, the yield increases by more than 90%. So as I said, each ml of the blood, each ml of the blood increases the sensitivity. and the sensitivity increased by 13%. Okay, this is quite significant, and it is recommended that in adults at least 16 to 20 ml of blood should be collected during per venipuncture, and in children it should be according to the body weight. So this is one study which was done for the detailed analysis, how much sample volume should be collected, and here you can see. So as the volume of the blood is increased, the probability of for the positive patients is also increased, and it's increased quite significantly from 0 to 20 ml. Okay. So more the volume, so more chances of positivity. And also same with probability for positive blood culture bottles. So if the volume is increased, the blood culture positivity is also increased. So, and second is the number of blood culture sets. So the set, more the number of sets are collected, so more will be the volume. So what is one set? One set is the blood collected during single venipuncture. So if we collect 20 ml of blood during single venipuncture, it is recommended that it should be divided into 2 bottles. So it becomes one set consists of 2 bottles consisting of 10 ml of blood in each. And ideally an aerobic bottle and anaerobic bottle is recommended. So aerobic bottle containing 10 ml and anaerobic bottle containing 10 ml. So here we can see there are a few studies which have been done in the past, and with increase in number of set, so like 2 set and 3 set, the percentage yield is increased by more than 90% as compared to 1 set where the yield is comparatively low. So and also the sample size we can see is quite significant. Okay, so 1 set will give you 65% recovery, 2 sets will give you 80% recovery, and 3 sets will give you almost more than 95% of recovery. And also other significant aspects of this doing 2 sets is it's to rule out the false positivity. So sometimes there are issues which might be due to contaminants. So the number of sets, it will help in you differentiate between true pathogen and the contaminants, and also at the same time it increases the volume drawn, which increases the sensitivity as well. So this is one good study which I have been done. Here we can see this cow, which represents. One second. Okay. So you can see these cows which represents the bacterial concentration in the blood that varies with time, and and this concentration may be low, but it's not. Oh, sorry. Yeah. So the concentration it's low, but it's never null. So and this dotted line it's the limit of detection for bacteremia. And here we can see the smaller when the smaller volume of blood is collected, the test becomes less sensitive. We can see the negativity rate is very high, and it's indicate and it might indicate you the sorry. Yeah. So the negativity is there are chances that if blood is not collected on time, there are chances that the sensitivity is less. And here you can see the overall result suggests that it might be intermittent bacteremia. At the same time, when larger volume of the blood is collected, throughout the time period there are chances that the blood culture might come out to be positive. So the sensitivity increases with the volume of the blood. Then the third aspect is blood culture collection. So standard precaution must be taken, and strict aseptic conditions should be observed throughout the procedure. It is dedicated staff should be present, and like proper blood culture collection tray should be present, especially in the critical care unit for the blood collection. So if blood is not collected properly, strict aseptic conditions are not maintained, as I said, it might lead to contaminations and false positive results. And what might be the eventual outcome of this? We might end up giving unnecessary antibiotic to the patient. Giving unnecessary antibiotic, extended long stay, and false positive results it might lead to antibiotic resistant infection, and giving unnecessary antibiotic, it might lead to in the long term may lead to acute kidney injury, and also exposure to hospital acquired infection because of long stay in hospital. So so this might affect both the treatment outcome of the patient as well. And the next important aspect to consider is timing of the blood culture. So why timing of the blood culture is important? As I said, most of the patient have might receive antibiotics. So it is recommended that blood culture should be collected within first hour of recognition of sepsis before giving any antibiotic. And if the patient has already been given antibiotic, it should be collected just before the next dose is due. Because during this, the concentration of antibiotic is very low. And also, like in patients of infective endocarditis where continuous bacteremia is there, we can collect the blood like intermittently, like within 1 or 2 hours apart. But in usual cases where the intermittent bacteremia is present, it is recommended that the blood should be collected at one go, and preferably within 1 hour. The next is selection of the culture media. So why the selection of the culture media is important? To overcome, we have in the wide range of blood culture media are available in the market, such as aerobic plus, anaerobic plus, lytic, anaerobic, mycosis, ICF, myco-F lytic. I will take you through this. So to overcome the challenges in blood culture, such as delayed and reduced recovery, patient who are already started on empirical antibiotic therapy, so their constant antibiotic is already present in the blood, and this might hamper the recovery of the bacteria also. Low volume withdrawn, isolation of molds and mycobacteria. So these are the challenges which are faced with the conventional blood culture. So as I said, when the patient has come into the emergency, or if it is already present, is in the ward, the patient comes with the symptoms and he started on empirical antibiotic therapy, and the blood culture is ordered. And so as I said, the antibiotics is already present in the patient blood. So these are the statistics which we can see. 28 to 60% of the patients are already on the antibiotic therapy when the blood is drawn for the blood culture. So this is quite significant number, and this might affect the recovery of the bacteria. So for this we have a solution known as BD Bactec Plus media. So BD Bactec Plus, as the name suggests, it contains resins. So we have patented unique resins. These are divinyl benzene polymers, and this resins, white resin and dark resins, can neutralize 14 classes of antibiotics, 10 classes of antifungal drugs, 10 classes of anti-cancer drugs, and 4 classes of antifungal drugs. It can also neutralize carbapenems, which are routinely used in the ICU setups as well as in the wards also, and also other antibiotics which I will be covering in the subsequent slide. So neutralization of antibiotics will eventually prompt to recover more bacteria. So the recovery is 40% more as compared to the conventional or standard blood culture media. So here we can see it can utilize almost all classes of antibiotics, including which are routinely used in the wards. This is a FDA document. Here we can see. So this is an FDA document which also shows it can utilize ertapenem, ertapenem or imipenems, and also all routinely used antibiotics which are used in the wards. So this is the same document continuation. Okay. And other media which is present with BD is Bactec lytic anaerobic media. So lytic, as the name suggests, it will cause lysis. It will cause lysis of RBCs and WBCs, and this lysis occurs due to the presence of saponin in the blood culture media. Okay, so lysis of RBCs, it will release the nutrients for the bacteria to grow, and lysis of WBCs, it will release the phagocytous organism. So eventually, it is more recovery of the organisms is more and faster. So here we can see with the use of lytic anaerobic media, the recovery is 14% more and faster, like 5.5 hours faster time to detection as compared to the standard anaerobic media. And ideal recommendation is for the blood culture media is we recommended to use is the perfect pair. So perfect pair means lytic anaerobic plus anaerobic lytic anaerobic and aerobic plus. So use of aerobic plus will factor will helps in neutralization of antibiotic, and lytic anaerobic will cause lysis of RBC and WBC that helps in more recovery, and it will cover wide range of organisms, both aerobic and anaerobics. Okay. So this was the study which was done, and in this they have used the perfect pair. The use of perfect pair, that is aerobic and lytic anaerobic. Now we can see the recovery rate with lytic anaerobic and aerobic. The recovery rate is 94.5%, as compared to the conventional in which the recovery was only 75%. The next is the BD Bactec PEDS plus media. So as we know, incidence of sepsis is very high in neonatal case as well as pediatric patient. So this is specifically designed for pediatric patient in which the volume of the blood which is drawn is very less. So even 0.5 ml of blood when collected is sufficient for the bacteria to grow in this media. And also if in adult patients sometimes there are challenges like in cancer patient we don't get enough amount of blood. So even in that patient we can use this PEDS plus media. So even like 0.5 or 2 ml of blood is sufficient for the bacteria to grow to optimum level. And also this media can be used for sterile body fluids. Sterile body fluids, as we know, the volume of the sterile body fluids is also less. We can't get sometimes 8 to 10 ml of sterile body fluids. So this media can also be used for that purpose. And other media is Bactec mycosis ICF media, and mycosis ICF media. So sometimes in polymicrobial sepsis, where we there is the co-infection of bacteria plus fungal infection. So this bacteria, for specific recovery of fungus, we need to inhibit that bacteria, which are growing in that. So for that this media is recommended. Okay. So this media consists chloramphenicol and tobramycin. This will inhibit the bacteria and increase the yield of fungus. And apart from this, it contains selective nutrients such as brain heart infusion, SPS, and yeast extract. I don't want to get deeper into this. So these are specifically recommended for in which we want to increase the yield of the fungus. So these are the specific studies which have mentioned that almost 80% of Candida species, and also like Candida glabrata and other organisms like Cryptococcus neoformans, Saccharomyces, were recovered within 16 hours, which is quite significant as compared to the other media when we consider aerobic media and others. And also other organisms like Aspergillus were significantly recovered in this media. So this was the study which was done, and in this we can see like almost 100% positivity for yeast, that is Candida samples, and also so here we can see it's like 100% of Candida species were isolated in the mycosis ICF media. So it is ideally recommended this mycosis ICF media can be used as a third bottle in immunocompromised patient in which the chances of fungal infections are very high, and also the patient with central venous catheters as well as implantable devices. And also it can be used for sterile body fluids. Other media is Bactec mycoaphlytic media. So as the name suggests, it is used for isolation of mycobacteria, yeast, and fungus from the blood and sterile body fluids. And it also contains significant saponin for lysis of RBCs and WBCs. And lysis also released, as we know, the mycobacteria are usually present in WBC because they are phagocytosed by WBC. So this media can help in increase recovery of this mycobacteria also. So we have in genetics we have BD Bactec blood culture solution, and they are using our blood culture solution. It based on advanced fluorescent detection technology. It has a continuous monitoring technology, and it can detect the bacteria as early as within 24 hours, depending on the culture and yield. So to conclude, blood culture remains the best approach to identify microorganisms when bloodstream infection is suspected, and to guarantee that antimicrobial treatment will be adequate for starting the or to optimize the antimicrobial treatment for the patient. And as I said, collection of the blood culture is important to reduce the contamination rate and in reporting of the blood culture. And at the same time, clinical and microbiological correlations remains the mainstay in reporting. Uh, thank you for your patient listening.